Welcome to the Setiba Medical Spa podcast. Setiba Medical Spa offers aesthetic and wellness services located in Westlake Village, California. We offer state-of-the-art treatments which are administered by our professional team of highly experienced and licensed practitioners.
Hi everyone, this is Emilia, CEO and founder of Setiba Medical Spa. Welcome to another episode of our aesthetic show from Setiba Medical Spa. And today we have Dr. Azizad with us. Welcome, doctor.
Thank you so much for having me.
Of course. It's great to have you here.
No, it's a pleasure.
So, doctor, I know you do all the non-surgical and some surgical treatments. Can you tell us a little bit about yourself?
Of course. I'm an internal medicine physician. I have a private practice in internal medicine. And then I also have an aesthetic practice. I've been doing that, I think, 15, 16 years. And my private medical practice, we've been doing that for about, I'm getting old, 23 years or something. It's crazy.
You look good.
Thanks. And then we have a research practice as well. And so we do a lot of things. But in diversifying that way, I think it helps me appreciate different aspects of doing the cosmetic work, doing the aesthetic work, because you are able to see patients differently as opposed to seeing them medically. And then when you're seeing them in an aesthetic setting and understanding the medical components that go into their aging process, it really makes a difference. I think over the years, as I've developed my techniques and gained this experience to provide for patients that unique look that they might be looking for, I found the benefit of the medicine behind the aspect of the treatment to benefit the patient as well as the spa. Our place is called NTU Aesthetics. It's in Northridge. And we do a lot of the things that most people come in for. And some of the things I wanted to go over is just aspects of why a patient comes in to see us, things in terms of the nature of what is beautiful or considered beautiful, and then what the different modalities of treatment are that you provide, we provide, and in hopes of making the patient come closer to what they're looking for.
Of course.
And I know you do an amazing job with that consultation because you go through like a half-hour, 45-minute consultation with patients to really address those needs at Setiba.
It's very important to do a good consultation to see what patients they're looking for, and we can deliver what they're looking for.
Right.
It's very important. So to do a good consultation.
Yeah, and that's the thing a lot of people miss, because most patients, when they come to see you, they might have seen a friend that had Botox or something on TV that showed a procedure, and they have no clue whether that procedure is for them. But they think, hey, let me go ask this doctor and I want this done. And they come to you and say, I want a filler right here because I see a line. And when I first started, I think I would follow what they told me. Like, you go to a lot of courses, you learn a lot of techniques, you kind of master what you want to do. And then you think, I'm going to do that. And that's what the patient wants. And we both are happy. But as you do this for the number of years that I've been doing it, and I know your experience is incredible in this, what they want or what they think they want might be addressed better through doing something different than what they're asking for.
Exactly.
For instance, when people come in for the nasolabial folds or the smile lines and what have you, they'll say, I need a filler right here. And people used to do a lot of that. People would push so much filler in that area, and then a lot of unfortunate outcomes where you look more masculine or simian or unnatural. And I know you guys moved way beyond that a long time ago, and it's incredible to see that outcome. But what we learn or understand in the aging process is we have superficial fat in the midface, we have deep fat in the midface, and as we age, that deep fat slowly goes away. And then the superficial fat migrates down, and then it hits this ligament, and then it kind of can't go any further down, so it bulges out, and you get this line. So a lot of times people just address it by filling in this line.
They need lifting.
But it didn't do anything.
Right.
So now we address that mid-face area by putting filler in a different area. So these conversations just evolve with patients. Like, if you really want to address this better, let's fix this area. And I know that patients might not even know about that or not understand the aging process. But once you explain this modality to them, then they're more apt to do it. And the outcome is better. Now, the other flip side is some people go way too far and do too much in the mid-face, and then you get too much of a look that way. So it's all the nuances of understanding that everybody has a natural beauty. Everybody comes in with something.
Right.
And if you can address the accents of their look, less is more, and the more you do, the worse the outcome. So you want to do less and give them a better look and slowly work your way up. And that's why I'm excited about a lot of the lasers that have come in to tighten the skin. And I know you guys have Morpheus 8.
Yes.
And we could talk about that a little bit just to show how that's different from the fillers to make the face actually move back a different way than the natural aging process.
Which treatment do you like better? Like the treatments that naturally simulate the collagen, or Botox and fillers?
Right. I mean, that's a great question. I think it all depends. Like the Morpheus 8 is a radiofrequency laser. It's a great way to bypass the surface of the skin and go deep and make the collagen stimulate to become tighter, in essence.
Yes.
And that slowly draws the skin back. And I wouldn't say it reverses the aging process. It slows it down, definitely. And it, to a certain extent, makes it more youthful. It's a great investment for anybody for their skin because it's just background. You need that collagen formulation to be on your side as opposed to the ticking clock.
Correct.
And some patients come in here and say, if I do this, do I have to do Botox? Well, Botox, you're trying to paralyze muscles that are moving, that are causing lines. It's like if you have a carpet. If you keep folding the carpet, you're going to develop a line.
Correct.
And no matter what you do to the collagen, if you keep folding that carpet, you're going to develop a line. So Botox you'll always need also in the background, just as a prevention of that folding of the carpet. So if you prevent these muscles from working, then you could prevent this line from forming. And I like Botox even as a preventative for patients that come in the early 30s or even late 20s to prevent the 11s. And as you get older, you could do more Botox to address certain lines that have formed or prevent lines that have formed. So I don't think the Morpheus takes away from that. It just depends on the look. And there are patients that will not touch toxin because they hear things or they're organic or what have you, and then they love just doing lasers, which is great. But in essence, if you're really addressing lines that we attribute to what looks as aging, like crow's feet or the lines on our foreheads, then Botox is the way to go on that. Now, in terms of filler, laser like a Morpheus versus a filler, it just depends. If you have a lot of superficial lines or just lines that are coming from genetics, like fairer skin gets more of the finer lines, then I think a Morpheus is great. But if you have deeper lines or a lot of hollowing from weight loss or just in general aging, then the lasers can't give you that fullness. So you need a holistic approach of looking at the patient, making sure that what their needs are specifically and what their budget is too, because these things have a cost.
Correct.
If money is no object, then you do sort of like a stepwise approach. You never want to do everything at once because even if the look is great, you're just not used to it and you're going to hate it.
You have to have a treatment plan.
Yeah, a treatment plan for sure. And it's time. And you go back 3 months, 1 month, whatever it is, and address different needs, and everybody's happier that way. I think where you fall, or sometimes you get led the wrong way, is when somebody wants to do too much on you too quick, and that's usually a sign that the outcome will not be to your advantage.
100%.
It's always to their benefit because obviously the cost goes up, but to you it's just too much, too fast. Most people will notice you've had a lot of work done, and nobody likes that.
No, you want to look natural. You want to look at the way that people can look at you and tell you look good, but they can't tell you what you've done.
Exactly.
That's the good result.
Yes. If somebody says, "Oh, you had work done," usually that means the person that did it didn't do a great job.
I agree with that.
Yeah. And it's important to know that, different things for every individual makes them look older to them. Some people, because of genetics, might have big bags under their eyes. And I know you guys have this amazing machine, and we're soon getting it, the Agnes, and
Yes.
it addresses that fat pad under the eye and tightens that skin a lot more. And you guys have been using it for how long, the Agnes?
We have been using Agnes since December, and
Wow.
we are happy as a provider with the results, and patients, they're very happy with the results.
Right. I was impressed because I had a patient who came in who was actually going to get married in about 6 months from the time she saw me. And I didn't have the Agnes, but she had such big bulges under her eyes. We addressed other things over time, but I referred them to you. Even after one treatment, her eyes looked so much better.
Oh, wow.
And then she had her second treatment before she went out to get married. So it was a big difference. That's why I'm so excited about getting it as well.
Yes, it's a great equipment, and we combine it with Morpheus 8.
For the face?
For the face, yes. So when we do the Agnes around the eyes, we do the Morpheus on top of that.
Oh,
The
makes sense.
results are amazing.
Oh, wow. No, it's
Combine-
exciting. Because a lot of people will do the fillers, will do the Botox, but then they still look tired because under your eyes you have bags or the darkness or the micro lines that just crinkle up that Botox can't address.
Exactly.
So I think that's a big plus.
I'm
for-
not a big fan of fillers under the eyes.
I agree with
No
you.
matter how good the injector is, it gives a puffy look around the eyes.
Right.
It's not natural.
And I've found that because I actually refrain most of the time from doing under the eyes as well, just because nobody's ever happy. You're never happy. The patient's never happy. In the end, you're like, why are we doing this? Patients think it's the greatest thing because they'll see it somewhere, or they think that hollowness is, oh my God, that I need to fill it in with something. But the worst thing is to make something look worse than before.
Yes.
And a lot of times, especially places where you put too much filler, and it's a place that doesn't have a lot of hiding to it because it's very narrow and thin skin, you'll see the side effects of filler. And that side effect is basically to pull in water, fluid to itself.
Exactly.
And so it might look good today, but tomorrow, let's say you're retaining more water or something's happening, all of a sudden you'll get more swelling.
Exactly.
And often you're absolutely right. It's not ideal. I'd rather do the lasers too. I'd rather show them other modalities of how to address it
Better than the filler.
than the fillers.
We have patients that they come and say, they show us pictures and say, hey, look at this before and after pictures. And I'm like, you see the after picture right after they did the treatment.
Right.
If you do a follow-up in 3 weeks, the pictures, they don't look like that.
Yeah, I agree with that.
So don't trust all the before and after pictures for the fillers.
Right.
Because right away it looks good. But
Right.
after 3 weeks, 4 weeks, it won't be the same.
Yeah, even like months later, patients come back months later say, why is this like more puffy now? And I am a big proponent of avoiding filler under the eye for the same reason. I mean, it's probably the most worst outcome area you can perform. It's one of those places where the probability of getting something good as an outcome is lower than is higher than something bad, or vice versa. But nonetheless, I wouldn't recommend it to most patients. You really have to know the practitioner. They have to do a lot of it. And even when they do, just do little by little and,
I would say naturally stimulate the collagen around the eyes. Microneedling, Agnes, Morpheus 8. The result lasts longer and naturally.
Good.
You
And you
are-
guys have that other laser too for skin lightening for the darkness.
Adva.
Yeah.
We have Adva and we have Q switch.
Oh, very
That
nice.
helps with darkening, with the dark circles.
I'm really impressed by the ADVA. 'Cause,
Have you tried it?
Yes, I came by and one of your nurses, Quinn, performed it on me, and it's amazing. Your skin lightens up so much more. And I always worry about IPLs even because you could get hypo or hyperpigmentation, or patients just burn or what have you. There was no discomfort, and you could see it right away, and then like 2 weeks later, it's even better.
Yes, I love Adva. I recommend it to all the patients that they come in, they have melasma, rosacea, or they have an event. I tell them come like a day before or sometimes on the same day.
That's
You can do
incredible.
the treatment, no numbing, no downtime,
Right.
and the results are amazing.
No, and the good thing is it's better than the IPLs.
100%.
Yeah.
You can do it on any skin type.
That's incredible. How long have you guys been using that?
About 2 years.
Oh, wow.
About 2 years.
Yeah, I don't know why I hadn't even looked into it because I thought IPL is IPL. But, Setiba is the place where they're on the cutting edge of anything that's good or new or trend, that is beneficial to you. I think they have any of those modalities there.
Definitely. Um, Having a medical spa or working at a medical spa, it's all about the providers and having the right equipment
Right.
for the variety of patients.
Right.
Some skin types are harder to treat, so you have to have a right equipment for them.
Right. And with the Advad, you could do skin type 4 and 3.
5.
5, wow.
Yes.
That's great. Yeah.
Very
'Cause
safe.
the darker the skin is in an IPL, you can't use that energy because you'll get a lot of what's called collateral damage where you'll burn good tissue. But with this laser, you don't have that problem.
Absolutely not. And these days, everybody done IPL.
Right.
And after 5 or 6 treatment when you do it, so if you have a pigmentation, it's already gone, and IPL won't give you the same result of when you got it the first time.
Right.
So after that, you need to move to a different treatment.
Right. No, I'm impressed by that quite a bit. It's one of those things that I think is a hidden gem. I don't think a lot of people have that also.
Advo, no, it's a newer machine.
Good.
It's a newer machine, and we are happy.
Good.
We are happy
Good.
with the
No,
machine.
I'm very happy with that. I mean, one of the things in my experience, and you get exposed to a lot of machines. You get exposed to a lot of, whether it's the gigantic ones like CoolSculpt or whatever it is. Every 6 months to a year, a new version or a different machine comes in, and these are very expensive machines to buy into as well.
Yeah.
And in my lifetime of doing this, I've been disappointed by many machines. I can tell you that. And you spend a lot of money and you don't get the outcome you want. And unfortunately, it goes in the closet, or you
I
just
know.
cut that. But the good thing is when you find something that's so beneficial, that has virtually no harm. I mean, those are the things that keep your practice going, as well as keep your patients happy, as well as keep you sleeping well at night, not worrying that somebody's going to have hyperpigmentation or hypopigmentation.
It's very important. Customer service, patient care is very important.
Right. I agree.
One of our policy, or what we tell all the providers, you have to see every single patient as like their family member.
Right.
If you don't do it on your sister, your mom, you're not going to offer it to the patient.
Right. No, I love that. That's how I've always practiced. I mean, as long as you do great work in a manner that's empathetic to the patient's needs as opposed to your financial needs, the money will always come. That's not what we're here for. We're here to provide a care that, whether it's medical or aesthetic, in the end, both benefit the patient's general well-being.
Definitely.
And as long as you're not thinking, I'm just doing a procedure so you're never going to go wrong in aesthetics.
Yeah.
And as long as you're safe, obviously you guys are incredible. And most places that I've ever gone to with doctors and what have you, they're very conservative. I find the conservative doctors the best and most reliable. Not to say that there's no leading edge or what have you, but a lot of times when you're not, and let's say in the industry where you're not a supermodel, where you're not like wanting everything done, when you're just, normal person, normal job, in aging, you don't need to be in the cutting edge of things, but you want to be in the safest hands. You want to be in the reliable hands. You don't want to be in places where they say, well, it worked for the last 10 people. I don't know why it didn't work for you.
Right.
So you don't want that.
But patient, they trust us. They come
Right.
to us. It's their time, money, as you said, and it's their face.
Right.
So we have to be very honest with them and tell them what they're going to get.
Yeah, and I've learned you can fool people once, but they'll never come back. That's not the way the business grows
No.
anyway. I mean, the beauty of providing good care at good value and making sure that patients are happy, that's the ticket to being successful in anything, in all honesty. But in this specific field, if you can provide good care and in an honest way where they know you're not cheating them, they know that even if they might have to pay a little more to see you because there is a benefit that they can't get anywhere, they'll do it. They know you're going to be there for them, and they know that you're not doing something frivolous or something they don't need. And on top of that, they're going to look much better than they did before coming in.
I agree with you, and thank you. Thank you
Absolutely.
for sharing that. You'd mentioned pricing. I know, I'm sure you get that. Patients come and say, okay, Morpheus 8, for example, we're charging $10. And they say, oh, there's another doctor, they charge $5.
Right.
What is your response to that?
Yeah. And you get this often. I mean, you get it a lot with Botox. You get it a lot with commoditized things like fillers and Botox and some lasers. I mean, IPL or laser hair removal is a great example.
Yes.
Laser hair removal has been so commoditized, meaning that everyone does it, that it's basically a race to the bottom. Who could do it the cheapest? And in the end, one, your time has value.
Yes.
So you don't want to be like, all right, I'll do it for $5 or $2. I mean, you're putting your time, your expertise into a procedure. And a lot of times, the other person that's cutting price is probably not having a lot of repeat business, so they have to cut the price. So that tells you a lot too. Like if you're going to go somewhere to get something, as long as you understand you're not really highly frivolous charging patients, if you're really charging patients to these levels where everybody else is not there.
Right.
As long as you know you're about fair value with your expertise, and you find somebody that comes in cheaper. I always tell them if that is what you're going for, then please go to that place, because over here you have to pay at this level for what you get at this level. And there's a quality basis. You never want to compete on price. You want to compete on quality.
Quality.
And a lot of times patients will rather pay more and get quality than pay less and be regretful that now I have to do it or fix it or whatever it may be. So I've never competed for price. I mean, I even do liposuction. We do tumescent liposuction in the office. And we don't charge, crazy prices for that. And we've been doing it for 14 years or something. We were one of the pioneers in the office doing this. And in all honesty, I don't charge a lot just because I always feel like if I was a patient that, this is what I would think is affordable. It's not like, they might be able to pay a lot more, but it would put them out quite a bit, and I would feel bad about that. So, but they will come and they say, on TJ, I can get it for this price. And I say, you can go to TJ, but what's going to happen if something is not right?
Right. That's correct.
And, and most people don't go to TJ to do it. I mean, obviously there's good people in TJ too, and not to say that you just can't get bed. It's like delivering a baby. When things are going right, everything's fine. Anyone can do it. But if things aren't going to go right, you better have the right place, the right people involved to make sure everything's okay. So don't race to the bottom. And if you think somebody's too expensive, you might be right. You just kind of shop around. Like some places, they have higher rent, so they have to charge more. Some places, have more expertise and they have to charge more. Or some places, but in general, for things like Morpheus or lasers that are well known, there should be like a general standard. You shouldn't have to pay 3 times more.
Right.
At a different place, because the laser and the techniques, for the most part, most people have down. Now, if you're doing something specific where it's like a new technique on lips with filler or something like, that takes a little more experience, then you might find that you have to pay for that expertise at a different level. I've had patients pay 4 times more Botox at places than
I know.
was. And I wonder, it's the same muscle groups. We all know where those muscle groups are. And unfortunately, patients think they're getting something different and a different product even, which is not the case whatsoever.
Do you think it's because of their marketing or how they're branding themselves?
No, absolutely. I think they can get away with it.
Okay.
They have enough patients that probably are a little more affluent or have more money.
Okay.
But even if I had those patients, and I do, I wouldn't charge them more just because I could. I just find it ethically.
Yes.
There's a margin that you try to hit that you're comfortable with. But if you're going to the levels of, just because you can and just because you think this person can afford whatever, it's just, I think ethically to me, that just not what I'm made out of. So
I love that.
I
love that. And we know some of your patients, and they love your office. They love what you do. And one of the reasons we would love to work with you, because you have the same manner towards the patients.
Yeah.
Customer service. And
absolutely.
I love that.
Thank you. No, we love working with you guys. I mean, whenever I have a patient that, obviously you guys they benefit from your services, whatever it is. I have no hesitancy. Half the time I just text and make the appointment for them. So it
Thank
makes it
you.
easier.
Of course.
Now,
Thank you for that.
and it is hard to find those kinds of places where you can, it's so similar to your ethics and needs and how you practice. Because you could, every block there's a aesthetics place
Yes.
now. And you wonder what the heck is going on. Why don't they all just work together, But you'll find they're very different. Every place you go to will have its own feel. And unfortunately, it's easy to make an aesthetics place and put some people in there and say, just do the work and people will show up. And they do this with laser hair removal. You'll see places just new, which was that went out of business, that new laser or something like that.
Yes.
You buy 5 lasers, you just keep.
It doesn't
moving
work like
from-
that.
Yeah, you
It doesn't. If you think you can just rent a place, have the equipment, hire like
Right.
2 nurses to do the treatments, it does not
It
work
will not.
like that.
Yeah, it
You-
falls apart quickly.
You have to know the language for aesthetics. You have to have experience.
Right.
100%.
And there's an eye to beauty. You have to have it.
Without any doubt.
Yeah, and unfortunately, especially for my field in medicine, a lot of doctors just go into the aesthetics because one, it's they think it's a good financial move for them, and it's different because in medicine, a lot of times we go into medicine because we're more of that left brain, right hand kind of analytical, science-based things, and then art is technically associated with right brain, left hand, and what have you. So if you're not really adept already into the art of aesthetics or understanding beauty or even appreciating beauty, you find it very challenging quick. I've gone to I remember advanced courses or any kind of course, and you'll have people that were gynecologists that just said, "Oh, I have a lot of women patients. I might as well do this."
Do that. No,
It's not something you should do if you just might as well do it, because if you don't have the passion for it, you won't strive to become better at it. You'll just do it at a level that their patients here. It's a convenience issue for them, for you, and you do something. But if you really understand beauty and go to the depths of understanding each individual's beauty, then I think you can get to a level where you should go into aesthetics as a business as well as something to provide patients.
Definitely. So, guys, do your research before you book an appointment to see your doctor or going to a medical spa. It's very important. Experience is the main thing.
Right.
So, Dr. Azizat, for the patients that we can do treatments on them, let's talk about fat reductions.
Okay.
I know you do body contouring with Morpheus 8 and another treatments that you do that we don't do as a medical spa. Would you
Yeah. I mean, a lot of times the main thing I hear is like if you have in menopause a pouch, or you have just areas of fat that you can't get rid of because of aging, and the dynamics of exercise will just not take away your love handles. I mean,
Right.
we're not 16 anymore where we could just change our food and run a couple miles and things just go away. So we've experimented with a lot of things over the years, and things have come across the business. I mean, there's Cool Sculpt out there, Sculpture, and then what we do is liposuction, because in our experience, you really have to go in there and contour the body with a wand in terms of taking out fat and a distribution where you can see a nice shape form. With things like Cool Sculpt and Sculpture, you put modalities on the body and hope that the fat melts, melts, and then you get an outcome that's similar. But it's not. It's never the same. As much as it's so much labor-intensive procedure to do something like a liposuction, and it'd be much easier to put a patient in a bed, put some machines on them, and walk out and let it do it on its own. We've never, wanted to be that because the outcomes are not the same.
It just work on one spot, correct?
Yeah, when you do,
It doesn't cover
Cool
the whole
Sculpt.
area.
Right, and even with that, it's hard to predict what the outcome will be, whether the
Right.
patient's spot will be what they wanted it to be in the first place. So when we do liposuction with tumescent numbing, meaning we do localized numbing, we don't necessarily need to put patients under anesthesia.
That's very good.
Yeah, that's the highest risk factor in these procedures, so we avoid that. And we're able to really hone in if somebody has just one little area or just the love handles or something like that, to give the results without putting the patients at risk. Nobody wants to do something if, their life is going to be at risk. I mean, it's not worth it. If it were that kind of risk to benefit ratio, I would tell them, just stay home, don't come do these things. But we've done a great job with that procedure, and the patient's outcomes are so wonderful. I mean, even if somebody wants like a fat transfer to the butt, we provide that.
I've seen pictures.
It's good. It's a great procedure. You have to have the fat. People don't realize when you transfer fat, you want fat that will stay.
Yes.
Just because you have fat. And we have a consultation, talk about how long they've been with the shape they've been. I mean, if you're going in and out and, gaining weight 1 week and losing it the next week, that fat's not going to last when you transfer it. So once you have that conversation and you understand the fat is good to be able to transfer, then you could see what their needs are of how much. Sometimes they're so skinny, there's not a lot. So they're like, oh, take it from here, take it from there. You're like, it's not going to work out. Or they take it from my mom or something, you're not going to make that happen.
God.
But if we do end up finding good fat, then it's a great place to transfer it. Some people call about breast. I mean, I don't recommend that as much because one, there's issues with mammograms later on. They don't know if that's a fat transfer. The tissue's always changing, so there's a lot of issues with seromas and whatnot. So I don't do that as much. But for the butt, it's a very static, area that kind of maintains itself pretty well.
When you do the fat transfer, if they lose weight or they gain weight, does it affect that?
Yes.
How does it work?
It's a good question. Now, that fat is usually the fat that's been around for a long time. So now if they go on a major diet or, something happens, that fat is going to respond to that diet. And we see sometimes a reduction. The main thing is not that the reduction, more like within the first month if they lose those fat cells. Okay. So you want fat cells to survive. Once they survive, then patients generally maintain it pretty well. But if they do eat a lot, then it will transfer to that area as well. It's not uniform. It's usually, nobody ever complained, hey, it's gotten bigger. I don't know why.
Oh.
But, it was a big move. BBLs were much more popular, I think, 10 years ago than they are now. I mean, patients are, I think society or the youth now are more apt to accept body image as it is, as opposed to forcing a different image. So people are more comfortable with the size they have. They might just want a little bit more lift as opposed to a big behind. But we used to do a lot of them. Now we can see that the science and the nature of society has changed in a way that they don't seek it out as much.
I say you have to be comfortable with who you are, with your body, your face, and if you want to improve it, go for it.
Right.
Definitely.
Right.
But be happy with what you have.
No, and if they're not, they won't be happy after you either.
Exactly.
Yeah,
exactly.
So it's a very important point. And you can pick those out too. Some patients, you're like, oh, and you tell them ahead of time, I could see what you don't like, but even if I do this, let's say we get a 30%, I'll be able to gauge how much of a difference something will be. And I tell them the honest percentage. Is it worth it for you to do this for 30%? Or is it worth it to do it for 60% improvement or whatever it may be? And then they make a better choice, because in the end, if it's not going to be their perception of better, it doesn't matter what you do.
Exactly.
It's a very good point to make with aesthetics, especially.
Very good. Very good. Doctor, what other services do you do at your office?
We do mirror dry, which is a very popular procedure. It's an underarm treatment for sweating.
Uh-huh.
It's funny because it's been around now since we were one of the first ones to get that machine as well.
My daughter came to you.
That's right.
Oh my God, when was it? 7 years?
I couldn't say that
7 years
of
ago?
HIPAA, but you can. Yes, I did it actually for my daughter too.
Mm-hmm.
She said, hey, I don't want to sweat anymore. I mean, nobody wants to sweat.
Yeah.
It's one of those things where obviously some people have hyperhidrosis where they just are miserable with the amount of sweating they do. But most of us are miserable with any kind of sweating we do. We wear nice clothes or go to a nice party, and all of a sudden you're like, oh, the deodorant's not working. So we've been doing this procedure where it's a type of laser. It's a microwave laser that addresses specifically those sweat glands.
Mm-hmm.
And the satisfaction on that is incredible because the misery of sweating is so high.
Yeah.
So we have, thank you letters like nobody's, like any procedure we do. I think liposuction and mirror dry give us the highest thank you
Oh,
letters of like,
wow.
you've changed my life. Like I've had patients that were going to move to Switzerland because it's cold and then they don't want to sweat. Now they don't have to do things like that. And then on the flip side, I have patients that have been doing Botox, which is a treatment for underarm
Yes.
sweating. And for some reason, they weren't told about this. So, they go every 6 months, spend a lot of money. But this, you do it once, most of the time, occasionally you need a second, and you don't never have to worry about it again. And I think that is a treatment that I feel good about when I give to patients, just because I know it changes their lives, and you're not doing something that isn't going to work, and it's going to keep bringing them back, and you're just miserable, they're miserable, and nothing happens. And it helps with odor. I didn't realize how big of an issue that was, but we have patients that just come for the odor aspect of the underarm. So that's a big deal, and it does some hair removal in there too. So,
Really?
I mean, I wouldn't address it like if you need hair removal, let's do mirror dry. But when you do it, especially for men, sometimes it's more sparse,
Yeah.
the area. But it's definitely a big plus for sweating and the odor. It's
Very good. We don't have the mirror dry at office, but we're doing Morpheus 8.
Do you find that beneficial for it too?
It works definitely for excessive sweating.
That's interesting. What's percentage that you get the benefit on it?
75%,
That's not
75 to 80%.
Yeah. Do you have to do the full 3 treatments or
3
one?
treatments.
Yeah, interesting. Yeah, I mean, we have the Morpheus too. I've never used it for the sweating aspect of patients. But maybe for those patients that sometimes just don't want to go through the mirror dry, we could try to address it that way.
Of course.
Yeah, it's a good thought.
Very good. Do you do any IVs?
No.
No. But you saved my life from COVID.
Oh, when we were doing the research.
Oh my
yes,
God,
yes.
yes.
We do, I mean, COVID was an interesting thing because, I'm part of Valley Clinical Trials, and we've been doing research for 16, 17 years with different aspects of post-clinical studies, usually phase 3 trials for diabetes, heart disease, hypertension. And when COVID hit, our aesthetic practice was closed. Technically, my
Right.
medical practice was closed because of just telephone. But we had Lilly and Merck and a few other companies that needed to do the treatments for the monoclonal antibodies. And the interesting thing was that we had no treatments for COVID at the time, so they needed this data. This was a promising treatment, and so and most people were afraid to even do these trials because you're exposing yourself to patients with COVID. Like you had
Right.
COVID, you'd call me, hey, I have COVID, and the next thing I would tell you is come in, and most people stay home,
Right.
don't come near anybody. So at that time, we treated, I'm sure, like 500, 600 COVID active patients intimately at, this kind of
Yes.
distance, because you have to examine them, go through it, consent them, and then give them this treatment. But I remember even within the first 3 patients we treated, I mean, the difference in like the next day for them showed us how promising these treatments would be. I mean, to this day, it's like, we were published in New England Journal of Medicine, and we've gone through all these things. And the basic idea is that when you do research, you really see how you can change society to benefit in these scenarios much more than like diabetes or high blood pressure. Because, in diabetes, you're doing the 4th pill of the same class or something like that. Occasionally you'll get a new class. But with COVID, it was such an incredible experience because, 1, it's life or death for a lot of us. And 2, to see that they came up with so many treatments so quickly and that it was going to be out at some point was really, inspiring to us. And we put, all of us on our research facility knew the risks, we understood, and we showed up, and it was 14-hour days,
Oh
7
my
days
God,
a
I
week.
remember. I
was
really
crazy.
appreciate the help
Oh,
of
no.
you. Your office was amazing. I remember when I came, I couldn't even walk.
I remember.
And then after the IV, I was just running.
Yeah, it was a good treatment. We still
Amazing.
do a lot of COVID treatments because, unfortunately, the virus changes, and whether vaccines will be able to keep up with it or not. We do a lot of vaccine trials with it. We do a lot of treatment profiles, different monoclonal antibodies, different pills, you have Paxlovid now. There was molnupiravir that we were doing. So there's a lot of good things that we see in the pipeline, and the future of medicine is so bright that they can, put things quickly in the need, if the need arises, that it's good to be part of that.
Very
for us.
good.
Yeah,
I
we
love
make
it.
that-
I love it how experienced you are on your medical field and how experienced you are on cosmetics.
Oh, you're so
It's
sweet.
very
Thank
good.
you.
Amazing.
I would get bored if I just did one thing. I think that's why I do so many things. It's the way to keep my mind sort of like okay. And it was good because in a time of we never thought aesthetics would be closed or our medical field. So it's
I
always good to have
know.
more than one way to kind of make your day work. So it was important.
How was your office after COVID when they said, okay,
Come back.
Yes.
Yeah. It
Was
was
it
it was a little
crazy?
initially because there was aesthetic physicians, plastic surgeons that passed away because they
know.
contracted COVID from patients. So there was always a fear as a physician because you're exposing yourself to someone. And you never know how COVID is going to affect you, no matter how much you've read about it or seen the statistics. Everybody that gets COVID has a different experience with COVID.
Yes.
And there's no predictive value to the extent that you want. So knowing that, especially with the original and the Delta and whatnot, it was scary for us as practitioners because we have to see the patient's face. So you have to take off their mask. You have to address areas that, they're unprotected from you and you're unprotected from them. Now, we would wear our mask, but was that enough? Could things happen? So, and then you're thinking to yourself, this is not like life or death. Why am I doing this? So it was different in the aesthetics for sure. But we were conservative. We made sure patients didn't have any symptoms ahead of time. We talked about temperature issues and all that. And then we provided a safe environment for them. So it was okay. And then given the experience I had with all that research and being so exposed, that it was a little more comfortable for me, but I didn't want to be too flippant and just expose myself. I'll be honest, even to this day, like if somebody calls our office on the medical side and has fevers and cough and stuff, we don't tell them to come in. We go through the symptoms on the telephone. One, we don't want to expose us, but more importantly, we don't want to expose other patients to this. And occasionally you'll see somebody walk in, you're like, that's what you think. I'm sick. I need to go see my doctor, but please
my
stay
God.
home. Call us when you're sick so we could figure out what might be going on.
So you recommend so what do you recommend for patients or for our audience now with COVID?
Be vaccinated and boosted to your age group. Have 2 boosters or 1, depending on your stratification of health. But definitely call your physician to at least let them know that you have COVID, because you want to be sort of triaged in some way. Because if your symptoms are severe, and there's Paxlovid available commercially. You can get it at the pharmacy. So call your physician, let them know your symptoms, let them know your history if you're diabetic or other comorbidities. Don't just say, well, things have changed since the first time or a couple of years ago that COVID came out. The medications do work well. Paxlovid works. We still have monoclonal antibodies. Molnupiravir is available in some places. But nonetheless, let someone know. A lot of times you might just need oxygen, you might need inhalers, steroids, or something.
Correct.
Don't play it by ear in that sense, because it changes day to day. Like you could be okay, and then the next day the symptoms just skyrocket. And then if you can't get a hold of your doctor by then it's tougher. So do that, but at the same time, don't rush out to see your doctor because you're going to expose too many people.
Exactly.
And unfortunately, the home tests often are negative, even though you have COVID. I think it has to do with how you're using the swabs and the techniques.
It's painful.
So most people just do superficial and kind of do what they have to. But if you have the telltale signs, just assume it's COVID till it's proven otherwise and talk to your doctor. And your doctor should know one way or the other based on like how fast it's spreading or what we're seeing in the community, what it most likely is. Like if you're the only one with these symptoms, maybe it's bacterial infection or something else. But if everybody like right now is having COVID resurge, then most likely it's COVID. And that's why we need to, minimize that exposure to the community by you staying home.
Doctor, I remember 2 years ago, they were saying, okay, if you have fillers or Botox, you can get vaccine vaccinated for COVID.
Right. I mean, there was always, I mean, the vaccines were new, so people would say a lot of things, and there was always this dynamic of mimicry or some sort of cross antibody thing that would initiate where either your filler would be an inflammatory process initiated by your immune system, or vice versa, where you would get worsening reaction to a treatment. I don't think that's the case, as people have done more of these studies. I think initially people, would point to anything or everything. But what I would say is, I mean, if COVID is rampant and there's treatment stuff, if you don't have to do something that badly, then, 2 years ago, maybe you should have just stayed home and not done a lot of filler. But nonetheless, I don't think there's a contraindication. There's no black box warning. We don't have, treatment profiles. We don't, in our intake, we don't say, oh, are you going to be on this drug if you're going to get this filler?
Okay.
The companies have never come out to verify these allegations. So,
Very good.
yeah.
Very good. So it's safe for the patients to do it, not be worried about it.
No, I mean, always be safe, know your profile, know what can go wrong, can happen. But nonetheless, I think as long as you and your physician are comfortable with your history, with your physical needs, and a lot of things. There's so much. If you have autoimmune diseases, you have a lot of things. You have to take all those into consideration before doing filler and putting injections into your body, because you have a foreign body, and if your immune system is suppressed, those things can be complications in
Very
the future.
good. Very good. Let's get back to body contouring, doctor.
Sure.
When we do a treatment, either Morpheus 8, M-Sculpt, XLS, liposuction, one of the main questions every patient has, how long the results last?
Right.
What would be your answer to that?
Well, it depends on what you're using, right? The Morpheus 8, we say a few years, because you're tightening skin, taking away some of the superficial fat. The XLS, I know you guys do a lot of that. I don't know what the history on that is, for a couple of years or...
It depends on for which area. Is this fat reduction or skin tightening? It lasts for like 2 years, but we definitely recommend them. You have to have a healthy lifestyle.
Right.
You need to do your exercising.
Right.
You can switch.
Right.
Not
You could all of a sudden mess it up,
exercising,
yeah.
not having a good diet, and
Right.
just do the treatment.
Right. In liposuction, it's interesting because in other forms of treatment, like the lasers and what have you, are doing some skin tightening. But in liposuction, when you take out the fat cells, the adipocytes, because that's what you actually do, is you're taking out fat cells, your appetite changes, because fat cells stimulate you to want to eat more. Like when you're dieting and you're shrinking your fat cells, they secrete certain things that all of a sudden make you want to eat. So they fight to stay big. So we find that with liposuction, when you take out these fat cells, those stressors on your ability to refrain from eating poorly go away. So you actually become better eater. Most people are very motivated when they see a jug full of their fat come out and say, oh my God, I do not want that in my body again. So that helps. And then their metabolism increases, because you have fat versus muscle as a metabolite. If you think about how your metabolism works, the more muscle you have, the higher your metabolism, but the more fat you have, the slower your metabolism. So when you decrease that fat, and now the ratio is the other way, whatever exercise you've done in the past, you're going to benefit even more now. So that helps. I've had one patient that had regained fat post liposuction, but she had to go on steroids for MS and high dose steroids. So those are the only caveats to regaining fat. Most of the time, patients ask, if I take my fat here, am I worried that it'll go somewhere else when I gain weight? And I always tell them this: then your thought process shouldn't be, I want to keep this fat here, so as I gain weight, I just keep gaining it here. That's not like a storage area for your fat. What you want them to do is get rid of this and not have fat ever come anywhere. Become healthier in your lifestyle, become more motivated to exercise. And so we've never had the issue of, why did I do this? I'm back to being my original weight. But you will see it when you do those really difficult diets. When you saw those TV shows where they make you lose 100, 150 pounds, the Biggest Loser or whatever it is, by extreme exercise, extreme diet, it can be done.
Yes.
But then those fat cells, once you stop those things, will tell your body, hey, let's start
Okay.
eating again. Let's start doing this again. And most of those patients, unfortunately, regain that weight and more. So that's why there's a good balance of understanding what fat cells do to why you would want to remove them. So it makes a nice difference for
So
that.
it goes again back to a good consultation
Right.
and describing to the patient what they need
Right.
to know and
Absolutely.
accept. And doctor, for lost weight, I know there is a medication called fentanyl.
Yes.
It works very well.
Yes.
Can we talk a little bit about that? Who's a good candidate for it?
Right. I mean, there's a lot of weight loss modalities.
Okay.
You might have read about Mounjaro,
Yes.
which is a new medication that is used for diabetics. And we did the trial for that, and it was recently published. And it's tirzepatide is the active name, but you lose 20% of your body weight with that kind of medication. It's an injection once a week.
Oh, wow.
And then there's Ozempic or Trulicity, and these are modalities we use for diabetics, but they are used in non-diabetics. And I use them in my private practice for weight loss because they help suppress your appetite or make you think better when you eat. They help you process the sugar better. There's specific enzymes missing in your body that they kind of provide for. So I find that it depends on the patient.
Correct.
If they're overeaters, if they have poor self-control, then those injections tend to be a better modality for weight loss. Now, if there are some patients that do well in their eating, but their metabolism is slow, then the phentermines are good because it does stimulate your metabolism. The side effect is sometimes you're a little more like wired or feel a little bit of angst in there. And that's the biggest side effect that people complain about. But if you go slow and kind of work your way up, the only downside is you could plateau. Your body will fight against what you're doing, no matter what you do. So often you have to take a drug holiday, like a month or two without the drug, and then let your body forget, and then reinstate the medication. But again, like you said, you have to have a healthy mindset.
Definitely.
You have to say, I'm going to change this to make this work. If everybody wants the easy, let me take a pill and keep eating cheeseburgers, it's not going to work no matter what you do.
No.
But if you are already on the path and you just want a little bit of stimulation to make it go faster, it works really well.
Very good.
Make sure you don't have heart issues. Make sure you don't have, some sort of arrhythmia or something like that. Talk to your physician.
Definitely. For any of the medications, they have to see a doctor, do a
Right.
consultation. They
Right.
can't just get the medications over the counter.
I have patients that go and get stuff from
Amazon,
Canada or
They do. Can we talk
Yeah.
about that, doctor, from
Yeah.
Mexico or
Right.
Amazon?
Yes. And I had a patient that came recently, a new patient, and he had been getting the Ozempic from Canada, and I said, like, what? And he just wanted to keep increasing the dose to all the way very high doses. I said, do you follow this? And do you know the side effects or potential harms? And they have no clue because they've never discussed it with a patient. He's never changed his health style.
Wow.
He hasn't gone to exercise. He just wants to keep increasing medicines. And these medications can cause pancreatitis and other issues that you don't want to just inflict upon or potentially harm yourself with.
Definitely.
Just because you've heard this does something that you want. So I agree. There are those. Don't be one of those. Don't go to Amazon to order your drugs. See a doctor. And that most doctors that understand physiology and these medications, they will be more apt to provide it for you. Obviously insurance and these things matter. These medications are not cheap. They can be expensive. But if you have
it's cheaper.
insurance,
I would say it's a lot cheaper when you see your doctor,
Right.
like in a right way, get a prescription than
Right.
paying like online or ordering it
Probably.
for somewhere else, and then God forbid something happens.
yeah, the cost to your health is more important than
Absolutely.
anything. Yeah, you're right. So but there are good things. If you really have weight issues, see your doctor. Those drugs for diabetes that are now actually we're doing the clinical trials just to do it on non-diabetics.
Right.
So soon they will be available as an obesity treatment. I'm sure the companies will charge 3 times the price
Oh,
for,
wow.
they know their markets. But nonetheless, they are very good drugs. And imagine just an injection every once a week
And you lose weight.
and you lose weight. So it's kind of
Hey.
nice. I know. It all
All
depends.
right. Perfect. Um, Dr. Aziza, it was very great having
thank
you
you.
at our show.
Oh, it
Thank
was
you
my
so
pleasure.
much for
I had such a
taking your
great time.
time. Of
Absolutely.
course. And I would like to invite you again if we can do this podcast another time.
Absolutely, yeah.
For
I had
sure.
so much fun. Thank you for having me. It's one of those things where I think the more we talk about this or make a general awareness to the public of the importance of these things and how to address them.
Definitely,
It's
because
better for
we
everyone.
know what are these treatments and what it does, but patients, they just hear the names and they don't know how it works.
Right. Good. Hopefully it was helpful. Thank you for having me.
For sure. And thank you guys for watching our this week episode. Make sure to tune in on our platforms, social media, YouTube, and looking forward to see you guys next week.